If you suffer from hay fever, you want to be able to tell it apart from COVID-19. It's going to save you a lot of time and stress. I'm going to try and be as helpful as I can so you can distinguish the two and suggest what you should do. See, the problem is that almost all the symptoms of hay fever are also symptoms of COVID-19. Now, yes, there are a few symptoms of hay fever that some authorities say that you don't get with COVID, like sneezing, but I wouldn't roll the dice on that. So how can you tell the difference between the two? Well, if you have symptoms of hay fever that feel typical for your hay fever from this list that go away completely within minutes, not hours or an hour, it's pretty unlikely to be COVID and you don't need to get tested. Now remember, they can't be accompanied by other symptoms like shortness of breath or an actual fever because those are COVID-19 symptoms. We're talking about hay fever symptoms typical for your hay fever that go away very rapidly. But what if the symptoms go away and then come back? And what if you're not sure you have a temperature because you don't have a thermometer? Well, this is why the standard advice is, if in doubt, get tested, which is great, but impractical if you're the kind of person who gets hay fever symptoms every day. And if that's you, the secret to answering is it hay fever or COVID is to avoid having to ask yourself the question by preventing the symptoms from coming on in the first place. Now you can do this by example, avoiding your known allergic triggers, using steroidal nasal sprays daily, and taking antihistamine tablets on demand whenever you do happen to get symptoms. There are many more options that I won't go into. Many patients I see are undertreating their hay fever either because they are underdosing, have an ineffective spraying technique, or just need to try something else. You should have a chat to your doctor to find out what works best for you. So, is it COVID or is it hay fever? Avoid having to ask yourself the question by preventing hay fever symptoms in the first place. If you do happen to get them, treat them quickly, and if they persist, either get tested immediately or speak to a doctor.